I was drawn to healthcare and to medicine by the community doctor in my hometown. I have a distinct memory at the age of 3 when I went in for my annual checkup. I looked up at him and said, "Dr. Gwynn, I'm going to be a doctor when I grow up." He began to talk to me about what that meant. I had a brother who was tragically killed in an automobile accident when he was in high school, when I was a freshman in college. That left me the oldest of 3 girls. I would say that my brother's accident changed the kind of physician I would be in terms of my compassion and how I deal with patients and how I have connected my head to my heart.
That empathy just goes such a long way in the setting that each of the physicians find themselves in when they are wrestling with how to make care its best and its safest.
We are a health system that serves primarily a 5-county area and probably about 130 total delivery sites. In partnership with her colleague, Bruce Swords, Mary Jo is responsible and accountable for safety and quality across the entire enterprise.
Her typical day could be anywhere through the system or anywhere in the community.
I say my office is in my car.
We've added hospitals, we've added hundreds of ambulatory clinics. A lot of that is due to Dr. Cagle's leadership in seeing the future of medicine.
There are days when I wonder if there's more than one Mary Jo.
My purpose is to learn from the frontline staff what's working and what are their barriers. I hear that your floor is one of our shining stars. We check with patients to see how we're doing in meeting their expectations and meeting their needs. Thank you. My very favorite part of my job is developing others to be their best self. When I see someone have a breakthrough and be able to develop a skill and apply it and shine, that brings me great joy. The end result of that is we are able to deliver superior, exceptional care for the patients of this community.
Mary Jo helped lead the creation of our Physician Leadership Academy.
The concept is there's a class of physicians, maybe 15 to 20 at a time, who intentionally do things other than medicine. And so it's a year-long process focusing specifically on teamwork and leadership skills. We have 100 graduates permeated and interwoven throughout the health system.
Mary Jo's unique ability to actually grow, develop, and create teams of leaders that operate powerfully and effectively is part of our secret sauce.
She's just a unique personality, interesting and inquisitive and a bit of a risk taker. I think in this environment, if you're not thinking outside the box and taking some risk, you're really missing some opportunities.
She has also brought a whole different culture to Cone Health. Some of that's relationship building, some of it is just pure accountability.
She has made a living, breathing organism out of the statement that you should be soft on the people and hard on the process. You need to make it easy for people to do what is right.
In recent years, Cone Health has really hit the high notes in terms of some of our nationally recognized performance. I don't think any of that would have happened without Mary Jo's leadership.
Those awards are great, and that's not why we do it. We do it because we want to give our patients and our community the best care.
Mary Jo was very good to always come back and anchor us in the fact that those aren't statistics, those are people's lives. She feels it, she projects it.
I admire her tremendously as a leader, and I'm very fond of her as a person.
Mary Jo in the office and outside of the office is fun. She has deep relationships with people across the system. Mary Jo and I are friends, our spouses are friends.
Hey, honey. I'm married to Randall Mashburn, and he would say we've been married mostly happy 34 years. I was attracted to my husband because he loves first edition books, and I love Southern women writers. I love this line, "You look like a peculiar little cat my papa used to have." We started traveling when our boys were young. They laugh now and said we didn't realize we were being educated while we were traveling. We thought we were just having a good time. And recently we've been adopting older dogs that need a home. My mom's in her 80s and moves between my house and my sister's in Alabama.
Mary Jo's very committed to her work, to patients and her family. And she is committed to make sure the physicians and staff that work at Cone Health are doing meaningful work.
She's inspired by the work that she does, and that's infectious.
I get to do work that I love every day. If I have had success, it's because I have a great team of physicians, administrators, and other clinical leaders.
She has done more as a senior leader clinically than she ever could have done curing one patient at a time. She is well deserving and has changed many lives in North Carolina for the better.